Hi, it's Dr. Noel Williams, Optimal Health Associates, Oklahoma City, Oklahoma. COVID update on Veterans Day, November 11th, 2020. Uh, I can see myself, and it's a little frightening, but I was using a chainsaw this afternoon briefly, and there's nothing more frightening than a gynecologist with a chainsaw, so I didn't change for the video. So we've gotten a lot done over the last few days. Big shout out first to the people at OU for putting on the press conference with Governor Stitt, the speakers, Dr. Chansome, Dr. Salinas from OU Infectious Disease, a brilliant physician, Dr. Cameron Mantor, who's head of pediatric surgery and chief medical officer there for the entire university, David Chansome, head of infectious disease, Julie Watson, who is a senior VP of Integris with a whole bunch of other titles, and then chief medical officer, who's just like the brilliant policy wog of all time that we're lucky to have on our group, plus all the other chief medical officers and physician administrators who were there with the governor's staff, Dr. Lance Fry, who's the health commissioner. Just too many people all on the same page. If you didn't have a chance to hear Dr. Watson's review of why you should wear a mask, you can watch it. We'll post it on I'll post her speech on our Facebook page, and we've posted the actual video. And the video, it's worth watching. And whether you're for masks or against masks, it's a relatively elegant speech or request for you to consider it and why. It's based on science. And it gets back to this whole concept, should there be a mask mandate or not? And different people are going to answer that based on politics and not as much on science and reality of being in a culture and a society. And I think the bottom line is what we want people to do is wear a mask, because you don't know if you're infectious or not infectious with COVID at any given time, because you can be asymptomatic. Now, if you've had COVID and you have COVID antibodies, yes, that's an exception, but it's still relatively few of you who know that. So, and then people won't understand it anyway. So, I would encourage everyone to wear a mask at all times when they're in public. I think you need to wear a mask in small groups when possible. But you can take it off when you're eating. But again, if you start eating with several people that are from different households, that is how you get infected. That's a very common way. Small groups are the problem. It's not so much large groups. But again, large groups are a problem too. It's any conceivable way you can get the virus. It does occur. It's not a political ploy. I still get texts and emails about that, and I just think, I don't want to say anything too negative because you lose the audience then. But the virus is there. I want you all to believe that. We've made great progress with the state. We're getting our system integrated. Our last piece right now we've started to work on, which is as patients from the incident command center, where patients are first getting diagnosed and then getting sent to hospitals, to the hospital care, to the ICU, getting them out of the ICU, getting them to a step down unit within the hospital, to a step down unit potentially out of the hospital, but if they still need care, and then to a situation where they can recover when they're doing pretty well, but they're still infectious. And because we have to have that whole throughput done, and I think we're getting very close to it, because if we have good throughput, we can have more hospital beds as needed. And so that's really helpful. Then that's what I would call vertical integration of the healthcare system. And then the horizontal or supportive healthcare things we need to think about, again, is logistics, meds, vaccines, getting that flow to the hospital, PPE, which is all going very well. But then it's retarding cases, and retarding cases is about wearing the mask, socially distancing, washing your hands. And we're going to talk eventually more and more about Thanksgiving and how important it is that you don't have multiple households. You can glare at me for saying it, but again, I'm doing public health. I'm your best friend. Okay? I'm doing public health. Public health is about trying to save as many people as we can from COVID and to keep our hospital systems functional and active and excellent. So that way if you have a heart attack or a kidney stone or whatever, you can get the services you need immediately and not get delayed. And that's important. And if you've ever had a kidney stone like I've had to go to the ER, believe me, you don't want to have to sit there 18 extra hours before anyone does anything. And so even though a kidney stone won't kill you, it's horrible, and we're fortunate in the United States to have those things. So let's compare and contrast numbers for a second. So first and foremost, we had 145,000 new cases yesterday in the United States. We're clearly in the peak, or coming up into the peak of the second wave. We had about 2,000 in Oklahoma. I think the rolling average is about 1,700. We're still having a daily death rate of, I think, 10 to 14 in Oklahoma over the last week. And while that's disappointing, we are still in the top 2 or 3 states in the United States for care and the lowest rates of death. And that's because we have the premier medical system in both Tulsa and Oklahoma City and throughout the state, and motivated, caring Oklahomans, which is, again, what we're trying to get everyone to be by wearing the mask. So things to think about in the near future. Again, I have to be very circumspect about making any formal recommendations now about how I would want people to be and what you need to be doing in terms of augmenting your immune system. I will put that article on tonight after we're done with this on immune support, but I'll do that separately. So if it gets taken down, even though the title of the article is immune support for SARS-CoV, it's a published journal article and valid. I don't have any expectation it may not get taken down because they don't want us to talk about any of that stuff for some reason. There's still no outpatient treatment strategy that's approved. We floated that balloon up to a couple different places, but there's just not a lot of traction since the FDA doesn't feel that it's useful. And so it's really hard for umbrella medical organizations or other organizations to go against the narrative. So that's life. The vaccine from Pfizer looks like it gets a really good antibody level going to the neutralizing antibody. I don't know if that's going to be as important, is going to be successful in terms of treatment. I hope it will be. We'll have to find out, because there's a difference between having a huge amount of antibody from a vaccine and does it actually protect you. We don't know the answer to that. But the preliminary data is you do get a really good amount of antibody, so that's great. And then number 2, it's well tolerated and safe in theory, but again, we don't know yet, and so we need more data. But some preliminary stuff at least is reassuring. The vaccine rollout, when it happens, will go to first high-risk people, so think elderly first, people with multiple medical issues, and then high-risk medical professionals, so everyone working at these tertiary care centers. Will then go to secondary risk people, so people with some risk factors, and then someone like me, if I wanted to do it, that's a doctor and takes care of people, because I'm a health provider, but I'm a lower tier, which is appropriate. So I'll have months and months, hopefully, to see how it's going before I would ever have to make the decision to do it or not, which I think is great. I'm missing a whole bunch of stuff, but I just think we should all be positive. The Oklahoma plan is working. We're getting things organized. I can't say, and again, for you people who are just so political you can't hear me, the governor's office is doing a great job. We've spent a lot of time with Lance Fry, the health commissioner, who's fairly universally reviled in rural Oklahoma for actually doing stuff to help the state. But then the people in the metropolitan areas are mad at him for not making draconian measures that wouldn't work. So that poor man who's working so hard for everyone, everyone's mean to him. It makes no sense. He's a great guy, and he's an OBGYN. So darn it, be nice to your neighborhood OBGYNs. And he's a colonel. He's got all this leadership training. He's a spark plug. I mean, he's great. So that's really the stuff. We were asked to participate. The governor's office did ask us to try to reach out to people in Tulsa to try to get the same thing going there. The state's very happy with what we've achieved in Oklahoma City in Region 8, I think we are. And they've asked us to participate in Tulsa. If the Tulsa people want us to, we'll see. I've talked to one doctor who's a chief medical officer, waiting to hear from her. We want to help any way we can. And then another thing is there's going to be hopefully a massive amount of public service PSAs. What's the A? Announcements. Sorry. I have cheeseburger hangover, and And then, but it was a really good cheeseburger from S&B. So I will say that. So, but there'll be public service announcements, and then probably physicians and potentially the governor hitting the rural communities and really promoting mask wearing. And remember what the governor said: any locality that votes to do a mask mandate, he's supportive of. But he believes very firmly it's region by region and city by city. And I think that is meritorious because I'm a libertarian and that's how I look at it. So, sorry. I think you always are better as an evangelical when you're convincing people about a subject and getting them on your side versus forcing people to. So what else do we need to talk about, Kim? Some questions?
I have a couple questions. And then, did you talk about the melatonin study?
There's a melatonin study from Cleveland Clinic that was an artificial intelligence summary of repositioning medicines and things for COVID. And someone, I don't know who, may have been mentioning you should be on melatonin this whole time. And again, I don't know who that was. But the bottom line is this study showed there was a 30% reduction in COVID-related illness in people on melatonin. Oh, that brings up the MMR, the measles, mumps, and rubella vaccine. So there's another paper that was out this week, a few days ago, that showed there was probably cross protection to COVID if you've had a measles, mumps, rubella vaccine. So again, the advantages of being an OBGYN, we all have had to get those multiple times because we have to stay immune when we're doing OB, and not that I do OB. But then think about it. All pregnant women in the United States get the titers drawn on measles, mumps, and rubella. And it turns out that keeping that vaccine level higher looks pretty darn repressive or resistant to COVID in about 30% or more people who've gotten that vaccine. Again, preliminary data, very interesting, very, very immunologic genetic data stuff. But the authors felt kind of strongly enough to suggest that the one alternative to doing a new vaccine is just pop everyone with a MMR who doesn't have a positive titer, and it's $2, and we know it's essentially close to harmless across millions and millions and millions and millions and millions and millions of doses to people, and we protect 30% of the population off the top. So again, interesting stuff, all science, hard to be. I can still get pulled for quoting science, unfortunately, because we're in a, yes, fascist situation with these media companies. But enough of that. Kim, what else? I got to finish up because I'm at 12 minutes, 54 seconds.
Okay. Some are repetitive, but there's newer people. Thoughts on remdesivir?
Remdesivir doesn't work. Okay, that's the bottom line. It almost doesn't work. Now, if you use it really early, it may work, but for the most part, in hospitalized patients, it doesn't work. That's the new summary. Period. Done.
Okay. Does the kind of zinc matter? You've had that question a lot.
I think no. Zinc piconolate, zinc gluconate. Get some zinc. And again, I have to be careful on what I say, so I don't get another strike or I don't get it taken down.
Okay.
It's already posted on our site in a million places.
Yeah, and we'll do it.
And we're going to do a separate immune thing.
Yeah. Okay, so this is specific, but there's probably other people with this one too. So this person's husband tested positive in July, works in a setting where they're very close with their coworkers, and now several of the coworkers have tested positive. Does the person that was positive in July need to worry, and does the wife and the children need to worry about the exposure to the coworkers, even though he already had it back in July?
So that's a complicated situation. So the first thing is, if they're not Mink co-workers, meaning they're all working at a Mink factory in Denmark, Spain, or somewhere else in Europe, where there is a true new variant to COVID, that there is not cross-protection, it looks like, from a previous infection. It's our first true variant. And I've talked about there'll be a cluster of new cases that people have gotten again, or in this case, people haven't gotten COVID twice, but it's a clear new genetic variant in terms of the infection. So the Mink people are different, but it's just something to be aware of. There's actually a new variant. his chances of getting infected are very low, especially since it's within 6 months. That's kind of the standard theory. Number two, though, he could get the virus on him from being if some of his coworkers have it. And so the key thing is he has to wash his hands, and he needs to disrobe the second he gets in and take a shower and put his clothes in the washing machine.
That's
But-
all I have.
Okay, so that's it. So we'll talk more about the mink industry and the mink variant, or it's the number 5 mutation, I think they're calling it. So we'll talk about that later in the week. Be safe, take care. God bless.